So my name is Taylor Edelmann. I use he, him, his pronouns. I'm the program manager for the Lighthouse Learning Collective. I am a white transmasculine person wearing glasses. I have short brown hair. I have rather kempt facial hair. I have a lavender shirt on, and behind me is a very colorful background, gradient background with our Lighthouse Learning Collective logo. If you're unfamiliar with Lighthouse Learning Collective, we are a space for queer and trans drug users and sex workers to collaborate on projects. We meet monthly. We have a training series that we do. We came out with this guide. We have a toolkit for syringe services programs that we have coming up. So many things, which is super exciting. So I'm going to leave this up here for a second, but I do want to thank our wonderful collaborators. So National Harm Reduction Coalition, we have Gabriel, also Pooja from the Alyssa Rodriguez Center for Gender Justice, Miss Jai of Toadhenge Consulting, G Wallner, Ray Stevens, Sruti Mohan, Dana Fleetum, and Han Hamill, who did our wonderful designs for the guide. So I'm actually joined today by some of these folks, and I'm going to have them introduce themselves now. So I'm going to actually pass it off to Gabriel first.
Hi, everyone. Thanks for being here. My name is Gabriel. I use he and him pronouns. And I'm the co-founder of the Alyssa Rodriguez Center for Gender Justice. We strengthen gender justice movements across prison walls. Our work is based on the understanding that some of the most important leaders in gender justice work today are in prison. And so we work with gender marginalized jailhouse lawyers, including trans people, cis women, non-binary people, and we work to support, resource, and amplify the amazing work that they're already doing. And I am one of the co-founders of the Alyssa Rodriguez Center for Gender Justice, or ARC. I also, my day job is I am the co-interim legal director at the Transgender Legal Defense and Education Fund. And I worked on the legal part of the guide.
So my name is Miss Jai. I use she, her pronouns. I help healthcare and public health organizations learn how to better serve trans, non-binary, and intersex patients and clients through capacity building training, technical assistance, and organizational leadership. I'm the CEO and founder of Toadhenge Consulting, which started in January of 2022. So we've entered into our third year, which is very exciting. And I have a background in public health. I do harm reduction work, and my introduction to harm reduction work was through HIV prevention and care. And so I'm very excited to be here. I've been working in the field since 2011, but doing work voluntarily since 2004. So I'm happy to be here and to share my experience and expertise. And I'm going to pass it off to G.
Hey everyone, I'm G. I use they, them pronouns. I'm really excited to be here. I work as an HIV prevention specialist in Madison, Wisconsin, and also a videographer and filmmaker working on a documentary about sex education for queer and trans people. And I help run the HRT specific portion of our syringe service program locally here, and I'm really passionate about providing sexual health education that is pleasure-centered for all.
All right, G, we'll take it away.
Okay, hi. So I am talking about the community resource section of the guide. So this kind of comes after the section about working with your healthcare provider. But since some of us don't have the best relationship with our healthcare providers, or we don't have a healthcare provider, it's really crucial that we also know how to access our community resources. So the guide goes into finding community resources for accessing gender affirming hormone therapy. And it also goes into accessing other resources like the supplies and syringes needed for injecting, how to find those for free in your community at a local syringe service program. Places like Planned Parenthood and some online resources for actually accessing hormones. It also goes into like just maps of your local LGBTQ+ community centers. It's really great to be able to talk to other trans people to figure out your hormone journey. And then it goes into online support groups as well. We also have the mental health support section. So that includes things like the National Queer and Trans Therapist of Color Network, the Trans Lifeline, some youth talk lines, that sort of thing. And then we also have a sexual health resource section, which just has some really, really great guides that have been written over the years for trans people's sexual health in general. And yeah, so that was a very brief kind of guide overview on that section of the guide. And then I also just wanted to kind of touch on the long history before us that this guide echoes of resource sharing within the trans community. Because for me, it's really valuable, deeply meaningful to learn about our history and how we've been sharing resources with each other for so long. So I put together a couple images here, historical archival images that I accessed from the Digital Transgender Archive. And we've got some from STAR, which is the Street Transvestite Action Revolutionaries, founded in 1970 by Sylvia Rivera and Marsha P. Johnson. You can see their recruiting poster there. And they did so much for giving housing, resources, support to trans people who were on the streets, but also you can see their cake sale poster there, which I thought was really cute. And then there was also this underground educational magazine called Transvestia for trans femme people, which was actually going strong in the 1960s. So they were sharing books for trans femme people, where to find them. They were sharing how to kind of feminize your look, your dress, how to take on the social roles of being a woman in the 1960s. And they would have features like you see here of different trans femmes on the cover each issue. And then we've got the FTM International, which was a newsletter founded by Lou Solomon in 1986. And that again was just resource sharing. You can see some of the articles here, FTMs and hormones, testosterone availability, the chest issues, so all about top surgery. And I just think it's so cool that these things existed. They've always existed, and we're just kind of able to continue on this work because of all of the amazing trans activists and resource sharers who came before us. And then, yeah, I think it's just a good thing to mention that we can do this day to day too. Like we can just have conversations with each other. That's kind of the best way to do it. Sometimes it doesn't have to be a published thing or an organized thing. We can leave each other resources in our club bathrooms. You know, we can just talk and with our one-on-one with our friends. It's all really important for our collective liberation, just to do these everyday actions to take care of each other.
Yeah, thank you, G. You're getting a lot of love in the chat. I just want to shout that out. A lot of love in the chat. I wanted to let people know too, if you're interested in history, and I really appreciate the perspective that G's bringing here, Lighthouse actually did a queer history of harm reduction training with one of our Lighthouse members, Arlo Cruz, who's out in Colorado. So you can find that on our YouTube channel as well. All right, so I am going to pass it on to Miss Jai. It looks like your audio is back. You're here. So
yes,
let's
can
hear
you hear
it.
me?
Yes, we can.
It would be the moment before coming to the stage. My audio cuts out. So thank you all so much for being here. Thank you, G. And thank you everyone for kind of like rolling with it and shifting up our order. I'm going to be talking a little bit about how the guide helps us to ensure that our gender affirming hormone therapy meds are safe and legit, and also what to do when we're having trouble getting our gender affirming hormone therapy medications. Some caveats to this: I'm not a clinician or a physician. I work with clinicians and physicians, but my background is in public health and harm reduction, and so I'm not a prescriber. And so the directions that we are going to give are not around prescription specifically. There's also a whole section in the guide on different forms of gender affirming hormone therapy medications that we are not going to go into detail with in this training, but I highly encourage folks to check out the guide because it gives a lot more in-depth information. One of the reasons why we want to talk about medications being safe and legitimate is because we know that there are side effects to medications that we take. For example, testosterone can increase our red blood cell count, and we know that spironolactone can sometimes increase our potassium levels. And so when we talk about ensuring safety with our medications, part of this is medical review, making sure that we are connected to an affirming physician who's at a minimum able to track our levels and help us with using our medications safely. So first, what I want to ask folks to go ahead and put in the chat, the number 1, if you have ever had a challenge finding an affirming doctor. So if you've ever had a challenge finding an affirming doctor, go ahead and put the number 1 in the chat. Okay, so I'm seeing some ones. If you have ever spoken to someone who's had challenges finding an affirming doctor, put the number 2 in the chat. Yeah, so lots of folks either have themselves had challenges finding an affirming doctor or know someone that has had challenges finding an affirming doctor. And we know that being connected to healthcare is not the only way that we will be accessing medications, but we know that it can be very difficult to find a physician who at a minimum is going to meet, have an understanding of what it means to serve trans non-binary people. So the guide goes through some healthcare provider directories, such as the one from the Trans Legal Defense and Education Fund's healthcare provider directory, but also some ways that we can find affirming physicians outside of static directories. So recommendations on how to ask friends for referrals, how to ask an insurance provider if you do have health insurance for in-network options, and how to prepare for the experience of coming to a physician's office. So what questions should we ask? What should we do in preparation for bringing our request around gender affirming hormone therapy to a physician's office, knowing that we might be in a state where there is shifting legal ground? As Taylor mentioned at the beginning of this, the landscape is shifting very quickly. And because that landscape is shifting very quickly, sometimes our physicians don't know what they're legally allowed to do or how they're legally allowed to work with us. And so we sometimes have to come prepared to ask providers about their understanding of what's going on in our community and what their experience is working with our community as well. So that is the kind of the provider side. When we think about verifying our gender affirming hormone therapy medications, especially because this came out of folks purchasing online and being either sold something that was not the hormone they thought it was, or was coming from kind of a questionable source as well, there are a couple of steps that we can do to verify our gender affirming hormone therapy medications are legitimate. The first is to research your medications. So know what kinds of medications you are taking, what your combination of medications should be, and what forms those medications come in. Again, this guide gives a great overview of the types of medications and the forms that you might expect them in, and what combinations of medications might look like. If we know what medications we are supposed to be taking, then we know what we can ask for or what we should look for on these websites as well. The second is to check the packaging. So most medications have very specific packaging and labeling. Verifying that the packaging details, including any unique identifiers for the product, can be helpful. Checking to make sure that the medication is actually spelled correctly, or that the main ingredients are spelled correctly, can also be helpful. If there's misspellings on the packaging, if it's unclear what the dosage is, then those are big red flags that this medication might not be what you expect it to be. The third thing you want to do is check accreditation. So for online pharmacies, they might be accredited and recognized by pharmacy organizations. The legitimate online pharmacies often display seals of approval from organizations such as the National Association of Boards of Pharmacy. So we want to take a look and find like where those accreditations if those accreditations are present on the website. We also want to verify contact information. So if you're looking at the pharmacy and you don't see a phone number to contact the pharmacy, if you don't see an address of where the pharmacy is located, if you don't see a way to file a grievance or a customer service line, then these are also indicators that it might be difficult to have any sort of corrections or to get any support around your medications either not making it to you or the wrong thing making it to you. And then we want to also read reviews. So seek out reviews and testimonials from other trans, non-binary, and intersex individuals who have used the online pharmacy, and look off of the website, right? So asking folks on Reddit, asking folks on Discord or any of the trans Discord servers. G mentioned several of the community spaces and the ways that we can connect with community. So asking folks for their experiences working with these pharmacies can also help give us an idea of whether or not this is a trusted source in our community. And then finally, being wary of low prices. So sometimes if something looks too good to be true, it likely is. If the cost is incredibly, incredibly low, then it might be that you're not getting what you actually think you are getting, or you might be getting some counterfeit medication. So be wary of a low price. A great place to look to see kind of what a discounted rate for the medication would be going to a discount website. And looking up the coupons for that medication. That way you can get an idea of kind of what the medium range might be for the medication. Now, all that is to say, if you have access to these things, right? So we want to also talk about what it means for when you are having trouble getting your gender affirming hormone therapy medications. I know folks who both have a physician and have health insurance and have trouble getting their medications, and folks who the physician or a lack of health insurance is the barrier to getting their medications. So if you have a doctor, you want to continue to have your hormone levels monitored and other applicable levels. So again, if you're on testosterone, your red blood cells might increase. You want to have those levels monitored. If you are on spironolactone as a testosterone blocker for folks who are on feminizing hormone therapy, then you want to make sure you're having your potassium levels checked. So you want to continue to have your levels monitored. Even if you're living somewhere where your physician might not be able to prescribe gender affirming hormone therapy, you can still work with them as an ally in your care to check your levels. And that brings me to the second piece of this, which is treating our physicians like allies in our care. It can be really difficult right now working with a number of physicians. I know it's very difficult from the physician standpoint to navigate the legal mores of what's happening and still provide care to clients and patients that is equitable and that is appropriate. And so if you are working with someone who is already an affirming provider, then likely they're still going to try and do what they can to make sure that you are getting the best care that you can that is taking care of your full body. If you don't have a doctor, the first thing that we recommend is exploring some insurance options, such as Medicaid, Medicare, or the Affordable Care Act. Lots of folks may qualify, depending on the state that you live in, for government assistance, such as Medicaid or Medicare. And so that might be a way to get health insurance. And there have been recent federal releases, such as Section 1557 of the ACA, that now ensures that folks cannot be denied health insurance if they are LGBT or on the basis of sexual orientation or gender identity. So I think access to gender affirming care sort of through this workaround might be helpful for folks on a federal level. And then connect to care if possible. So this could be through insurance, but also working through some of the self-pay options, such as online clinicians that do telehealth via a subscription service. So some of the ones that come up very frequently are Plume, Folks Health. Those are two that we recommend in the guide, but also Gender GP and Circle Medical, which are other like subscription or self-pay options. If you are living in a state that allows for direct access testing, so if you've heard of direct access testing, go ahead and put the number 1 in the chat. This is the way that I can gauge whether or not folks are. And if you haven't heard of it, put the number 2 in the chat. Okay, so I'm seeing some mixes, but a lot of number 2s. So direct access testing is when someone is able to go directly to a lab to order labs for their overall health. They don't have to go to a physician first. Not every state allows direct access testing. However, the guide does provide a link to identifying if your state allows direct access testing, and sort of how to obtain lab work directly from the lab itself. So if you know your hormone levels need to be monitored, if you know that your red blood cells need to be monitored, your potassium levels need to be monitored, or you know what labs your physician would normally request, then instead of going to the physician, you may be able to directly go to the lab and request those labs if you live in a state that allows direct access testing. And then the final piece of this, which is also generally a large barrier to gender affirming hormone therapy, is financial assistance. So being able to actually cover the cost of medications, the cost of syringes and needles associated if you're using an injectable gender affirming hormone therapy. So financial assistance is available through gender bands and points of pride, for example. But there's also a whole host of resources for financial assistance if you can't afford your doctor's appointments or your medication. And some of those assistance also go beyond just gender affirming hormone therapy, so to other forms of gender affirming medical transition. So I encourage folks to check those out and help get the word out about that funding assistance as well. So those are some of the things that you can do when you're having trouble getting your gender affirming hormone therapy medications, and some of the things you can do to ensure that your gender affirming hormone therapy medications are safe and legitimate. And with that, I'm going to pass it over to Gabriel to talk through some of the legal aspects.
Hello again. So to get into the legal stuff, I want to start out by I guess sharing like a disclaimer. The tips that I can give on the legal front are about protecting your legal safety, which means that if you do them, it's less likely that you'll get convicted, and it's more likely that you'll be able to do something legally to try to hold the police accountable for doing something wrong to you. But of course, the police don't necessarily respect your rights. And I'm not giving tips that are about what's going to keep you physically safest in the moment, or about what's going to be, most in keeping with your politics in the moment. So take the legal information and use it to make a choice, but don't assume that this advice is going to be actually what will work best for you, given all the other considerations in a particular situation. And then also, even if you have thought about it and you've decided, if I'm ever stopped and questioned, I want to refuse to speak, it can be really difficult to actually do that in the moment, partly because it can feel terrifying when the police are questioning you, maybe yelling at you, maybe putting their hands on you, and then also because it just can feel rude. Like, we're not used to somebody just asking us a question and us just totally refusing to answer. And so I really recommend that people either find a friend who they can practice this with, like just imagine some scenarios and run through them, or visualize to themselves first. Like, what are the situations I can imagine being in? How do I want to respond in those situations? And the guide has several scenarios that give examples of a way that somebody might interact in that situation that doesn't follow the tips for legal safety, and then another way to do it that does prioritize legal safety. So check that out and use it as a way to practice or visualize. And one thing that the guide doesn't really get into in any detail is whether you are breaking the law by accessing hormones in whatever ways that you might be accessing them. That's partly because with the law changing so rapidly and with the wide range of situations people may be in, I can't really say globally what's legal or not legal. But it's also because, and I think we probably all know this, whether you're actually breaking the law it's just one factor in whether you face any sort of legal trouble for it, right? Technically, cannabis possession of cannabis anywhere in the U.S. violates federal law. But in states where it's not also against state law, we see a lot of people openly growing, selling, and buying cannabis, and people are just sort of assuming that the federal government's not going to enforce that particular law against them. And on the other side, there was relatively recently a Black trans woman who was arrested in Atlanta for having a stress ball. It's not illegal to have a stress ball. Cop was convinced that it must have drugs. A drug test came back negative. She was still held in jail for 6 months. And when she got out, she sued them and she got over $1 million. But the basic point is, generally, if you're getting self-managed care, there's a little bit more legal risk, but the legal risk isn't necessarily tied to whether you actually are breaking the law or not. In terms of ways to stay safer, there are a couple of things to think about in advance. One is just thinking about where you want to carry hormones and syringes. If you are carrying syringes, it can be a bit safer legally to either have a letter with you saying that you're a syringe service participant, or to have a letter from a doctor saying you have a prescription for them. If you're carrying hormones, you may also want to have some sort of documentation that you have a prescription for them if you do. But you also just want to think about what you're carrying where. If you're somewhere where you think it's more likely that the police would search you, then you might want to think about whether there is a safe place that you can leave your hormones other than carrying them on you. And places where police are more likely to search you tend to be places where the police are in greater numbers, including if you're going to a police precinct to report a crime. Unfortunately, I cannot tell you the number of people I have spoken with who went to the police precinct to report a crime, who got searched and then got charges brought against them for something they were carrying on them. Another thing just to know is that if you are arrested and you're in a police lockup or jail, you may still be able to get access to hormones. That's true even in states where there's very broad bans against gender affirming care, because under federal law, they have to give you necessary health care. And there are a lot of trans people on the inside who've been suing to get access to hormones for a very long time. Doesn't mean it's going to be easy, doesn't mean it's going to be a sure thing, but it is often possible. And to have the best chance of that going smoothly, it really helps if you know the type and dosage of the hormones that you're taking, and ideally also the doctor and pharmacy where you're getting them from, because sometimes the jail staff will want to try to call and confirm that you really were getting that prescription. And if they don't, they're at least going to want to know what your actual prescription was, or they should want to know. So having that information memorized, because you're not going to be able to have access to your phone, can also be helpful. And you also want to think about having memorized the number of a friend or somebody who you trust who can advocate for you if you do get arrested, and making sure that there are a couple people in your life you trust who would be able to find you and get relevant information if you were arrested. So this means, like, a lot of times, like, I can't bear to share my dead name ever. But if my dead name's on my government ID, then I still want a couple of people in my life to know it, because if something were to happen, they would need to know it to be able to find me in the system and to be able to advocate for me. So a couple of people who know, like, the name the government is most likely to have for you, your date of birth, and your medical needs can be helpful. In terms of reducing risk when you're dealing with the police, I mean, the most important thing is to just not talk. This one, I feel like a lot of people think that we know this. Like we've seen on TV, people getting read their rights, and we think that we know that we don't have to talk to the police. But people talk to the police all the time, all the time. False confessions happen. People answer questions without quite thinking it through that end up getting them in trouble. Sometimes people think that they do have an obligation to share, to respond because maybe they're not a citizen or they're under 18. This is a right that applies to anyone, anywhere in the US. Doesn't matter if you're a citizen, doesn't matter how old you are. You can refuse to answer questions if they may implicate you in a crime. And when police ask you questions, I feel like you should generally assume that they might implicate you in a crime. Like for an example, if a police officer stops me somewhere, maybe I'm driving, maybe I'm walking, and just asks me, hey, where are you coming from? And I answer, why not? It could be that I'm actually placing myself at the scene of a crime, and I don't know about it because I wasn't involved. But maybe somebody on the A train just got robbed, and if I say I just came from the train station, then I'm giving them something they can use to cast further suspicion on me. Which is part of why I say this can be really awkward and this can be really scary. But if a police officer stops you and asks you something like that, then what I would recommend from a legal perspective is to say, am I free to go? And if they say, yes, you're free to go, then just say, okay, I'm gonna go. Or if they say that you are not free to go, and say, okay, I want to talk to a lawyer. And then that's it, end of the conversation, right? There are some exceptions, like if you get arrested, they'll ask you booking questions like your name, your address, things like that. You can answer those types of things. If you want to report a crime, you're going to have to answer some questions about the crime that was committed against you. Like there are some exceptions, but if you're not sure, or if it seems like they're trying to investigate something, or if you think that it could conceivably implicate you in a crime, then the legally safest thing for you to do in every situation is to not answer. And the police can and do lie. It's not even, they're trained to lie. It's part of their job to use whatever tactics they can to try to extract information. You cannot trust them. You cannot trust their threats. You cannot trust their promises. You cannot trust their reassurances. You cannot trust them if they make statements of fact. Saying you want to talk to a lawyer and not answering the questions is just always going to be the legally safest thing to do. If they come to you at your home, somebody shared this analogy with me that you should think of them like vampires and that they can't come in without an invitation unless they have a warrant. I would add to that, you should think of them as exceptionally rude vampires, right? Because in vampire movies, you kind of have to explicitly invite them in. But in the way that the courts have looked at this, virtually anything counts as an invitation. If you just open the door wide, then they can count that as an invitation. If they say, we're coming in, and you say, okay, then you've just given your consent to them entering into your apartment, which is not what I think anyone would assume, but it is legally how it's counted. If you do or say anything that could be taken to indicate that you are okay with them entering your home, then you have given them your invitation. So if police knock on your door, the legally safest thing to do is to ask to see a warrant. And then if they do say they have a warrant, ask to actually look at it. And when you look at it, make sure that it was signed by a judge. There's such a thing as an administrative warrant, which does not give them the power to enter your apartment or your home. It needs to actually be signed by a judge for them to have that power. And it should say, your address, right? They get it wrong sometimes. Or they or they just think that they can show this piece of paper and you'll assume that it's valid because you're not going to check the address. Make sure that it is actually for what they're saying it's for, and make sure it's signed by a judge. If they show you that warrant, then you do have to let them in. If they don't show you the warrant, then say you don't consent to a search. If they're going to force their way in anyway, there's not really anything that you can do about that safely. I mean, legally, the safest thing to do is to stand aside, to watch what they do, and to say out loud, I don't consent to a search, but not to resist in any way, because that can lead to further problems. Now, how are you actually going to look at a warrant if you can't open up the door wide? The legally safest thing to do is to ask them to slide the warrant under the door, or for you to actually leave the apartment. It's safer because if you let them come inside, then they're allowed to look around and use anything that they see against you. So better for you if you go outside. And if they don't have a search warrant, but they have an arrest warrant, again, it's actually safest for you to go outside and allow them to arrest you. If you let them come inside, they will still arrest you, and they will also look around your house to see if there's anything they can use against you. And all of this can feel pretty daunting, but also remember that our communities have been targeted by the police in a lot of different ways over the year, and we navigate it and we survive it and we figure out ways to resist it. It is not our fault if police are violent toward us, and we are not helpless, even though it can feel like it in the moment. And if this is happening to you, there's a community of people who care and who will have your back. I feel confident. So those are the highlights that I wanted to pull out. But as Taylor has been pointing out, there is like a lot more detail and scenarios in the guide that folks can check out, and happy to answer questions in the Q&A. I'm also going to share, in case folks are in touch with people on the inside, there's a resource guide that ARC Gender Justice put together that's more facing people who are currently incarcerated. We're super excited to partner with Lighthouse on this guide that is focused on making sure that people on the outside can get access to care for the most part and don't get criminalized for it, which is crucial, and crucial for folks when they're coming out. But some of the strategies, like trying to find different doctors or medical tourism or self-managed care, just don't work as well if you're actually in custody, but there are tactics that can work. So I'll share that link.
Thank you so much, Gabriel. You just pointing out, you got a lot of love in the chat, a lot of people pointing out how helpful this information is. And thank you for sharing that. I do just want to quickly point out too that there's a lot of advocacy around this, especially in the state of New York, because Lighthouse is a New York focused, New York City focused program. So there's also the Trans Prisoners Rights Coalition of New York, lots of groups working on GAHT, which is the Gender Identity, Respect, Dignity, and Safety Act. So you can learn more about that. I'll put the link in the chat. And I'm actually going to pass it over to Ms. Jai, since we're doing really well on time. So Ms. Jai, I know you wanted to add one more thing in, so I'm going to toss it back over to you.
Awesome. Thank you, Taylor. I think after also, Gabriel, I learned so much from you in this section, so thank you so much for sharing your expertise. And it's bringing me back to the importance of us taking care of ourselves and recognizing that why we put together this guide is because we deserve care. We deserve, as trans and non-binary intersex people, we deserve care. We deserve to have our health needs taken seriously. And I think sometimes there is this, when there's this shifting groundwork, we might go on and off our meds. We might have challenges with suddenly being on testosterone, then off testosterone, on estrogen, and then off estrogen. And I really just want to bring it back to that we are deserving of care and having our health needs met. There's a section in the guide on self-care and monitoring. I noticed there were a lot of folks who introduced themselves in our chat this morning who are providers or might be interfacing with trans and non-binary and intersex patients or clients. And so the self-care and monitoring portion might be helpful because it tells folks if they're on feminizing hormones, what they should be looking for and what safe ranges are for the specific hormones in their bodies. If they're on masculinizing hormones, the same thing, when to get their labs done, and then some additional health considerations like weight gain, osteoporosis, your triglycerides, your cholesterol, your blood pressure. So I think the self-care and the monitoring portion of the guide might be very helpful for the patients or clients that you're serving who are trans, non-binary, and intersex, who are either having inconsistent access to gender affirming hormone therapy, or might be solely focused on their hormones and might not have thought about additional health considerations for going on and off those medications as well. So I just didn't want to let that pass by before without mentioning it as well.
Awesome. Thank you so much, Ms. Jai. And I'm just going to add us back to our spotlights here so we can get all the crew together, group photo. Just kidding. Something I didn't ask at the top was how many people, I'm going to steal Ms. Jai's idea because I absolutely love this. Put a 1 in the chat if you've actually read the guide, or at least a portion of it, because it is lengthy. We know that. Oh, look at that. Lots of 1s. Yeah, awesome. So it's been out for a little over a month now. So nice to see people interacting with it. Oh, there's Han in the audience too, and Dana, who helped put everything together. Just amazing. All right, so we actually have one question here. So we're more than happy to end it early if that's what folks want, but feel free to put your questions in using the Q&A feature. If you happen to put in the chat, I'm sure we'll see it. We're just trying to keep things a little Zoom organized here. So Gabriel, I believe this question is probably for you. So the question is, what are your thoughts on folks calling 911 if police force themselves into your home?
Oh, I mean, if the police force themselves into your home and you know it's the police, calling 911 probably isn't going to help. Would be my assumption. I mean, maybe there would be some situation where it would, but I have never heard of it actually helping. People do sometimes call 911 when police break into their home, especially if they don't realize that it's the police. Which, I mean, as much as I want to try to find like anti-carceral, non-police involved things, responses to situations whenever I can, I feel like if somebody's actually breaking into your home and you don't have somebody else who can help out, I mean, of course, you're going to probably call 911 if you're in imminent physical danger and don't have another option. But I mean, I think that probably calling 911, I don't know that it would make it worse. I mean, it could make it worse if the police who are breaking into your home are like separate or from like a different jurisdiction than the police who would come reporting to your call. Like having more law enforcement there, I would imagine could escalate the situation. But I don't think it's likely to actually help, unfortunately.
Excellent question. Thank you so much, Gabriel. I just want to make a point too. If you'd like to come off mute and ask a question as well, that's also a possibility. I can give you that ability. I know sometimes, there's a little more nuance with these things. So yeah, and you're welcome. Thank you for asking that question. A lot of the legal stuff, I mean, I have to say, just like Ms. Jai, I learned so much just by reading this and absorbing a lot of the information. And it was really serendipitous because Gabriel, I know you had reached out looking for some resources and we were putting this together and it all kind of culminated. We could have made this thing 100 pages. We could have made 150 pages, but at some point, enough is enough. And we encourage people to adapt portions of it, take pieces of it, interact with it in ways that feel good for you. I'm sure there will be more editions of it. Since I'm not seeing any questions here, I do want to let folks know, I said in the beginning, just in case people join later, that we are actually working on formatting this into Spanish and Haitian Creole. And we also have an ASL version of it as well. So we'll disseminate that, hopefully sooner rather than later. Ms. Jai.
I am just curious. So we spent a little over half a year putting together this guide. And so while we're waiting for questions to come in, I would just love to hear in the chat from folks who are listening in on this, if you already have some ideas of how this guide might be helpful for your work, or some ways that you're already using it, because I think that that helps us to understand if this is a useful resource for you all as well.
Absolutely.
Yes, or
And
ways
what
that
I
we
will
can improve
say,
on it.
yeah, absolutely. We're open to feedback. You know, obviously the work is personal to all of us, right? Being part of the community, but there are so many things I'm sure that we missed, and you know, we'd love to hear from people and make it accessible. What I will say too is once the webinar closes, you'll be directed to a very brief survey. It's optional, just asking you, you know, for your feedback, right? How have you been interacting with it? Because we've gotten some really key pieces of feedback. Um, Oh, look at that. Walker says, I gave this to my cousin who was, let me go back up, ordering her hormones from India, and now she's using Plume to get her hormones. And I'm just so happy she's being safer. Oh my gosh. Wow. That's makes me a little emotional, to be quite honest, because sometimes you don't know how these things land, right? Also, another comment says it'd be extremely helpful for where I work. I work at an LGBTQ wellness center, and people come in questions all the time. Yes, and please give that. And we're, you know, the goal too is to try to distill some of this into more bite-sized pieces, because it is so much, whether that's through social media, you know, other one-pagers. Laura says, hi, all just came from a national Latinx health summit, and the guy got a lot of interest from folks in the South and other jurisdictions working with trans Latinx folks. Amazing. Amazing. Michael says, as a medical clinic offering GAHT to our clients, it's very helpful for us to know the landscape and challenges of self-managed care so we can support those in any ways they may need. Yeah, I couldn't agree more. Yep, and Han says we posted it. Yeah, go ahead, Miss Jai.
Sorry, just for that last comment as well, Chase, you might also, the self-care and monitoring might be especially helpful for the folks that you're working with. I'm familiar with the organization, the program that you work for, and so that self-care and monitoring portion might be especially helpful for the folks that you are supporting who are navigating their self-managed care and finding their own supply.
Absolutely. And as Ms. Jai said, you know, we're not medical professionals, we're not doctors, we're not prescribing, but to be quite honest, a lot of this stuff we just had to learn from the other trans folks in our lives, and to learn how our bodies are responding to things, which can be very daunting and difficult given that the way the medical industrial complex kind of purports this, you know, paternalistic kind of thinking of, we know better for you, this is what's worked for everybody. I know for myself personally, that was not the case, and was experiencing things that doctors hadn't talked about, right? And so there were limited resources, and it was only in through speaking with other folks to really get that information and learn, you know, I'm not alone in this. There are other things going on. There are other options, other avenues. So that's really such a big point of this. Yeah.
And just if I could add as well, for the clinicians, physicians, care providers who are also on the call, because I know there are several that mentioned at the beginning, this guide can also be a good launching off point for better connecting with your trans, non-binary, and intersex patients and clients, because it also shows your investment in learning about the health of our community without relying on the patient or client to be the educator in the moment. So I encourage folks to also give this a read over and use this as a launching off point for discussions on what folks are experiencing.
Absolutely. So with that said, oh, and here we go. So the question just came in. Do y'all have a guide for folks who are navigating going to the doctor for the first time? I'm going to throw that out to the group, because we don't have a specific guide for that, but I think there are a lot of pieces of this guide. So I'm curious if G, if Gabriel, Miss Jai have certain pieces that they'd like to respond with. And then I think we'll just close it out since we're 2 minutes from the hour.
There are a couple of guides that I like, although I haven't created them. I'll just drop them in chat. You should respond, Ms. Jai.
I was just going to say, I run a program called Ask Miss Jai Live, and one of the videos that I did was how to prepare for your doctor's visit. And so I'll drop the link for that in the chat as well. And then there's also a guide that's going, well, it's also a guide and more of just like here's a couple of questions for you to ask yourself in preparation for your doctor's visit that will be forthcoming on my website as well. So I'll drop the website link, which has additional resources.
Beautiful. Yeah, I'm like, plug all the resources. That's what this is for. It's a great question. So since we are 1 minute shy, and we told you, we promised, right? We had a lot of content to get through, but we nailed it. So I just want to thank Miss Jai. I want to thank Gabriel. I want to thank G. I want to thank Travis for providing the wonderful ASL interpretation. I want to thank everybody who made this guide what it is today. And clearly, it is a truly powerful resource. And I think it's going to keep giving for quite a long time to come. So just to wrap it up, letting folks know that this is recorded, it's being recorded, we'll edit it, package it, put it up on our YouTube channel. So if you're not following Lighthouse, please follow us. We have some other trainings, other videos on there that you might find useful. If you are interested in joining Lighthouse Learning Collective, you can find us on NHRC's website at harmreduction.org, or you can just shoot me an email. I just put that in the chat, and then we'll get connected. So thank you, everybody, so much. I hope you have a wonderful rest of your week, and thanks for joining us today.